Welcome to the Health Talk on this channel. Today we'll briefly discuss ectopic pregnancy. We will talk about what it is, where it can be located, some of the signs and symptoms and complications if not managed in time. Now let's start. So what is ectopic pregnancy? This is when a fertilized ovum or the egg of the female after fertilization implants outside of the womb or the uterus. Most of the common places are in the fallopian tubes, maybe due to tubal dysfunction. Now, a study carried out in the teaching hospital in Ghana shows that out of 1,180 gynecological emergencies, 104 of them were ectopic pregnancies. Of these, 7 were unruptured. The others had all ruptured. Now, what are some of the locations that this ovum, fertilized ovum, can be implanted? The highest or the most common is within the tubes. So we have the tubal location. So within the fallopian tubes, that amounts to about 93% of all ectopic pregnancies. And it is usually within the ampulla, of the tubes. Now, the next that follows is interstitial, or sometimes some people will describe it as the conua. The interstitial is the joint or where the fallopian tube meets with the body of the womb or the uterus. That is described as the interstitial. That amounts to about 1.1 to about 6.3% of all ectopic pregnancies. And then the rare location is maybe cervical, ovarian locations, maybe cervical towards the cervix, about 0.15%, and then maybe in the ovaries about 0.5%. Now, it is said that sometimes it can even be in the abdominal cavity. It can even be implanted on the liver, but those are very rare occasions and rare circumstances. Now, what are some of the predisposing factors to ectopic pregnancy? How did I develop an ectopic pregnancy? Now, if you have had an ectopic pregnancy before, it is a risk factor to develop another ectopic. Chances are that you can equally have another ectopic pregnancy, so you should watch it. Now, if you have had an assisted reproduction technique like IVF, it can end up in an ectopic gestation. It's a risk. Now, the most common of these is pelvic inflammatory disease, where you have had infections involving your tubes and your uterus. Pelvic inflammatory diseases are ascending infections through the vagina, through the cervix, to the uterus and the tubes and all of that. Those inflammatory conditions can predispose you to developing an ectopic pregnancy. Endometriosis, where you have had endometrial tissues elsewhere outside of the womb, can lead to ectopic pregnancies. Now, tubal occlusion, when there is anything blocking the lumen of your fallopian tubes, such that a fertilized ovum cannot travel to the uterus or the womb to be implanted, will lead to ectopic pregnancies. And then you've had an IUD insertion. An IUD insertion is equally a risk to developing an ectopic. This is not to say that don't get an IUD if you need one. So if I have an ectopic pregnancy, what are some of the signs and symptoms? How would I know? 1, if you have had a period of amenorrhea, that is to say that you have missed your period. You were supposed to menstruate within a certain period, you have missed it and it is not coming. And you are now experiencing unilateral abdominal pain, one-sided abdominal pain. For example, you have pain in the left lower abdomen, which is persistent, which is severe, or on the right side. It can even be bilateral, or you can have pelvic pain, or that you are bleeding from the vagina. These are signs and symptoms that maybe you may be pregnant, maybe you may have been an ectopic pregnancy. So you should quickly get checked at the nearest hospital. Now, there are other signs and symptoms like dizziness, feeling that your heart beats fast, palpitations, you may faint. Okay, these are all signs that maybe you've had an ectopic, the ectopic has ruptured and you are now bleeding, either through the vagina or into the abdominal cavity. Now, if you have missed your period and you think you are pregnant and you are experiencing any of these symptoms, what do you do? What to do is take your purse, take your hospital card, report to the nearest hospital where you can be examined, investigated to either confirm or to rule out that you have an ectopic pregnancy. And when you do, or if you do, you get treatment for it as quickly as possible. Now, somebody will be asking, if I don't go on time or if I don't get treated, what can happen? Now, the complications are that you can bleed to death, especially when the ectopic has ruptured. You can bleed into the abdominal cavity, you can bleed from the vagina, you would have palpitations, you have dizziness, you can collapse, you have syncope, you can die if you don't report to the hospital on time. Now, even in the hospital, during the treatment, you can have some complications. I mean, every surgery has a complication. The treatment for ectopics is surgical, although there is a medical technique, but it is also associated with predisposing you to future risks of ectopic. So usually the surgical route is preferred. Complications from surgery may be bleeding, anesthesia complications, surgical wound site infections. All of these things are possible complications that may result, but your hospital will do well to prevent them. And once you have had one ectopic pregnancy, you have the risk to have another ectopic pregnancy. So please beware. Know this, save a friend.